Welcome to the Avanti Woman podcast. With each episode, each conversation, we aim to empower, connect, and build women to move forward, feel confident, and thrive in healthcare, finance, entrepreneurship, and philanthropy. We're glad you're here.
Good morning, everyone. I'm Nairi, your host with the Avanti Woman podcast, and I'm very excited to be here today with three phenomenal women, healthcare executives, Hannah, Mindy, and Gabrielle, to talk about and discuss a topic that's created a huge buzz out there, and it's on the front line of almost every national paper. The Inflation Reduction Act of 2022, which was signed into law by President Biden on August 16th, and includes a broad package of health, tax, and climate change provisions. Barely out of a 2-year pandemic, and we are hit by inflation, high prices almost on everything. Gas and food come to mind for me. I'm sure a lot of you guys will agree with that. And undoubtedly, we are headed into a recession. Actually, we probably might be in it already, some say. And some experts even foresee a depression. I sure hope they are wrong. So everyone's socioeconomic livelihood is at stake, but one predominant group that is most vulnerable are the seniors, the Medicare beneficiaries of this country, as most of them live on a fixed income and many of them live with multiple chronic conditions. Just to give you an idea, we're talking about 58 million Medicare beneficiaries in the United States today, and by 2030, this number will increase to 90 million. Well, today we're going to talk about the Inflation Reduction Act and how it will impact Medicare beneficiaries, specifically by helping them with their drug prices, which is one of the biggest costs in healthcare for this patient group. And but then again, the big question is it enough? Mindy, let's start with you.
Sure. Good morning. This is really a pleasure and an honor to be with such cool ladies on a lovely Saturday morning in Southern California. I'm Mindy. I've been involved in senior services and healthcare for over 35 years. For most of my career, I've been involved, serving older adults and developing programs. I've been professionally working in many different environments, both the nonprofit sector, the for-profit sector, hospitals, hospital systems, senior centers, health plans for over 20 years. And the last 10 years, I've been with Regal Medical Group, and I'm in their marketing, and I oversee their marketing and health education program.
Wow. Welcome, Mindy. That is amazing. Pleasure to have you. Hannah?
Hi, it's so nice to be back. Thank you for having me again, Nairi. I'm Hannah Eicher. I have been in healthcare for 40 years. I spent most of my career with health plans in a commercial large group. So I came into the senior population quite late when I was with Regal Medical Group with Mindy. I finally started to understand what seniors, the Medicare population, is facing. Baptism by fire, kind of, as at that time, my parents became Medicare age eligible and got quite ill. So I became a caregiver at that same time. And also my younger sister collapsed with a massive stroke, very young, 46 years old. So I'm officially a court-appointed guardian for my younger sister, who is now on Medicare. I am now with one of the largest Medicare agencies in the country, Applied General Agency. And so I've had through just lucky set of events, the privilege of working with all the arms of the industry that do touch not only people who access healthcare or need to access healthcare, but everyone who is now in need of getting Medicare benefits, and people who try and provide them and simplify that process. So I'm very happy to be on this podcast with you, Nairi, and thank you for organizing.
Awesome. Thank you, Hannah. It's a pleasure to have you on. And finally, our beautiful Gabrielle Rascon.
Oh, thank you, Nairi. And good morning to everyone today. It's such a pleasure to be here and to be able to talk more about what is really impacting not only the seniors that we see day to day, but really a nationwide crisis and impact. My name is Gabrielle Rascon. I come from a medical group background where not only am I involved hands-on with the marketing components, the engagement, but I also analyze the trends within our office, what we're seeing medically, what we're seeing on the clinical side, how it relates to the back end with administrative flows and processing, and then more importantly, how we relate education back to our senior patient population to make sure that the focus of what we're seeing on trends and what we're seeing in analytics relates back to our seniors so that they can have something to understand and move forward with on making sure they're prepared for day-to-day changes or even seasonal changes. Mm-hmm. So thank you so much for having me today. This has been an honor and such a gift to be among such intelligent and powerful women.
Well, thank you, Gabrielle. Great to have you on, and I'm truly honored to be amongst your presence, ladies. You're three phenomenal women who are movers and shakers in the healthcare industry, and I say that, with a humble heart. I've seen your work, and I'm so excited to have you on this podcast. So let's begin with some of the most significant changes happening in Medicare and how it's affecting the beneficiaries. The biggest changes affecting Medicare, one of the things I'd like to start with is something that all four of us have seen this past year, and that was the crazy Medicare Part B premium increases that came on in January 2022. And we heard all of our members, patients, like there was this huge buzz. So let's talk about that. What did you guys see and how did that affect your members? What was the feedback?
Well, I know that people were very angry about it, because, quite frankly, they were unprepared. Once the information started coming out about the reasons behind it, I think there was, which is really around the medications and, the new Alzheimer's drug that came out. I think there was some people who got it and who understood the mechanics behind it. But in general, people were very, very annoyed, really, really angry about it. And we heard from them.
Yeah, and that was one of the biggest, hikes in prices. We had $148.50, and we had about a $22 increase just overnight. So we're talking about a population that's living on a fixed income, and that's every month. That's huge. And it was because of the, how did we call that drug? Aduhelm. That's the name of the Alzheimer's drug. But, it's because of the same drug that next year the prices are decreasing, right? So they pretty much saw that really it didn't make sense. So the prices are decreasing back down to $164.90 from $170.10.
In California, we are lucky because we have many health plans who actually offer to cover the Plan B premium. So what we saw happen last year is one of our health plans just swept the market. And the worry was for our agents that it is not sustainable. So not only did they absorb the Plan B premium, they offered incredibly rich benefits. So they grew but like a mushroom. No one else pretty much grew. Everyone else just wiped their nose. Now this year it looks like they are not going to be able to sustain that not only those benefits but to keep that membership. So it kind of really destabilized the market. And created a lot of extra work for everybody. So it's unwise to make those kinds of decisions. So the health plans add really rich benefits, vision, dental, transportation, over-the-counter benefits, exterminator, just anything they can think of to really help seniors with costs, with costs of living. The seniors just simply, it's too complicated for them to figure out how to then tap into those additional benefits. So they feel like they were kind of sold a bag of goods. And we as an industry don't have a good mechanism to reach them and help them assist, because, they have to call the health plan for this and the medical group for that. And it just gets too overwhelming, and they end up not using it. Then it goes to waste. And so they feel like, they got something for, free, but it didn't work for them. So it's a miss. It's a miss.
I think one of the biggest takeaways from this time frame and the shift in price that we've seen thus far on the clinic side is we have a lot of senior members and their caregivers. I think a lot of times we forget that, a senior in analytics, or just thinking about a senior in one capacity, is not a single person. There's a family unit behind them. There's a team behind them. There's a caregiver typically. There's adult children taking care of their parents. There's siblings. There's loved ones. There's extended family. So the biggest response I saw was actually a huge demand in inbound calls. Coming into the clinic, wanting to understand more, seeking information, seeking education on how they can reduce the impact, how they can adjust budgets to make this more sustainable, understanding where this price hike came from. I do want to elaborate on that a little bit further, in that most of the calls that we received had clarified that they did not understand where this price hike came from. And there was even anger, both anger and fear, that something had occurred and their coverage had changed, that there had been a health plan switch, or that their benefits had changed, and that had occurred without their consent. And we had to come back and explain this process. And I think this is actually a big breakthrough within the industry to clarify, no health plan change had occurred. Your benefits are currently the same as what you had enrolled into originally, but this is actually a change occurring at the federal level. This is a Medicare Part B premium change. And that opens up, I think, the floodgates on Medicare education and what Medicare is really about, because you also have more mature recipients of Medicare benefits who are unaware of the process, unaware of what Medicare entails, what the parts are, the A, B, C's, and D's, and how that really impacts their day-to-day. So to put it simply, there was a lot of emotion. There was a huge demand and call volume to the office, but more importantly, and I'll segue to you, Nairi, there was a huge demand for education from a dedicated broker who could clarify that knowledge. So I would love to hear more about your role in this process, because I know people were looking to you and to other representatives in the industry who could clarify this change.
That's very true. I think again, I'm sure all three of you guys will agree, education and knowledge is what really is lacking in this field. And the role of the independent insurance broker is huge. And I think it's becoming even more, in demand. And I saw that firsthand. A lot of my clients, and for those of you guys who don't know, my professional background, what I do outside of the Avanti Woman is actually I'm an independent Medicare insurance broker, insurance agent. I do have an agency, but I've been doing this for 10 years, and I love servicing our clients and educating them firsthand. A lot of them did call saying, just like you said, Gabby, what happened? Did my benefits changed all of a sudden? What is this expense? And it was our responsibility to educate them, just like you guys did, that this is coming from the federal level, and that we can look into their benefits and we can see what we can do to help. Said Hannah, there were some plans that gave back to Medicare Part B premiums. However, we have to be very careful with that, because some of them give back and all the other benefits are fine, but others give back and then you're actually having a gap somewhere else in their benefit, such as, more money for hospitalizations or whatnot. But at the end of the day, from what I see, is one of the biggest areas of cost for these Medicare beneficiaries is prescription drugs. With the Inflation Reduction Act this is for the first time in Medicare's history, this is happening. And I think we really need this. Over the years, I've seen Medicare beneficiaries crying that they cannot afford their insulin prices when they enter that gap. Mm-hmm. It's, some of them calling me years ago, this is 2015, 2016, saying, how can I afford $500 for 1 month? This is really sad to hear such stories. So what is this law going to do? The first thing it's going to do, the amount of money beneficiaries in drug plans will have to pay for their prescriptions will finally be capped. And starting 2023, there will be a limit on out-of-pocket payments for insulin. Yay. I really think that
it's about time.
It's about time. That will be $35. Okay. And for those people who are on a standalone prescription drug plan, which has a deductible, the deductible cannot apply towards this. So they cannot charge these beneficiaries a deductible. So that is huge. Vital vaccines will be free. And one of the examples is shingles.
Yeah.
I've been reading so much about this. There's so many seniors that have actually commented saying, every year I skip my shingles vaccine because I can't afford it. And I'm so excited I can get it next year. Mm-hmm. So those are the 3 strong elements that are coming into with this law. In 2024, there'll be no more out-of-pocket costs in the catastrophic phase. For those of you who don't know, when we get to the catastrophic stage of prescription drug plans, beneficiaries have to pay 5%. And I was helping one of my clients. He has cancer. He has to go through this interferon treatment, and he's already in the catastrophic phase. His medication costs $21,000, and 5% is over $1,000 a month. So I had to help him get actually pharmaceutical assistance. So that is going to be eliminated in 2024, which is huge. And finally, starting 2025, ladies, the maximum out-of-pocket will be capped at $2,000 for all Medicare beneficiaries. So this is really, really big when it comes to prescription drug prices.
It is.
But here's my question to you. Is this enough? And if not, what suggestions do you have? What other resources can they tap into?
Is it enough compared to what? Compared to what's available in Europe? Is it enough compared to what's available in Canada? Is it enough? No, of course it's not enough. But it's a big step forward, right? It can we do better as a country? Yes. But it is much better than what it was. And we just have to keep pounding at it and improving it, because this is not a population that it's a vulnerable population that can least afford increases or costs that are not predictable, and we need to figure out how to really protect them.
In our country, if I can jump in,
sure.
Unfortunately, most older adults live with chronic disease. And how do you manage chronic disease? Usually by taking some medication. And I think the average number of meds not over the counter, prescriptions is, maybe 5 or 6. And as we grow older, the incidence of chronic disease and more serious chronic disease increases. Well, the population is living longer with chronic disease, so they need more medication, to have a quality of life. So my response is, no, we are not doing enough. And, there are programs out there, but again, it goes back to the issue that we mentioned before, is how do you access? People don't know.
From a medical group perspective, what kind of services do you guys have to offer these members when, they can't afford their medications, even though they have, some of these things are going to lower the cost, but are there any programs that medical groups offer their members?
It's our responsibility now to not only have different programs available, and just to name a few, will partner with a broker like yourself to provide an education and information on LIS, low income subsidy, to offset some of those costs on Medicare. We offer samples of prescription medications to help, again, if someone does fall into that donut hole and is now in catastrophic coverage and they're taking brand name drugs, we offer samples of those as well. So I think a forgotten component, or something that may not be considered in managed care, is that the HMO, or the Health Maintenance Organization of Managed Care, is responsible for preventing illness and making sure that we keep our patients or members as healthy as possible. The goal is having a provider and a care team that is not only championing and advancing primary care, but keeping folks who are with chronic conditions as healthy as possible and on top of their treatment. So what does that entail? That entails having a case manager who's available to help coordinate specialty care appointments and prescription drugs and any kind of ancillary services to ensure that care is being provided for. And then also, and as of late, this is something relatively new that I am seeing in the industry that is spreading quite quickly, is having a social worker that's on site and a staff member of the medical group, so that they can help coordinate consistent housing and food accessibility. I mean, again, my emphasis and focus is the northern Los Angeles market. However, I can't say with complete certainty that what we're doing is even going to be close to enough, or if we'll ever get there, because we still see seniors experiencing unreliable housing and inconsistency in food. And that's unacceptable. More needs to be done. There needs to be more education and awareness on programs, because I know that there are programs out there that can help not only offset some of these costs, but that can also help provide stability in day-to-day needs like housing, food, transportation. And then that's not even getting into the role of the health plan and brokers who can help provide even more benefits and education.
Can I just jump in and reference that, add on? One of the major trends in healthcare, in both hospital and working with providers and doctors, is the much broader influence and engagement of pharmacists on the team. So we've recognized that, the pharmacist has a really critical role in the coordination of care, and almost acting as a liaison between the individual and the doctor in many ways. And, they will review medications, they will talk with members and their families and see, oh, we can't afford it. What are our options, right? Can we try this? Can we do a step down or a step up to make it more, much better? These kind of programs, which goes to what we call social determinants of health, which is taking a very holistic view, of our older adults, and really recognizing that, it's the whole person you have to look at. There's many more things, there's reasons behind why they can't afford it. So just want to put out there that the influence and the engagement of pharmacists, has become much more influential right now, and really taking on a very critical role.
I think it's a challenge to really figure out how to have that that effect on them, to really understand that they need, there's a lot of help out there. Honestly, it takes a village to really care for someone. And I think when it comes to that, managed care is the way to go, because you are having that coordination of care between the primary care physician, the health plan, the medical group, ancillary services. And just like Gabby said earlier, managed care is really focusing on prevention and keeping the patient out of the emergency room, keeping the patient healthy. But how do we convey that message to them? I think one of the areas to really focus on is the primary care physician.
I would suggest extending that care model. And I work very, very closely with the medical assistants, the receptionists who are picking up the phone because they're the front line. So this goes back to, it really does take a village. And we spent a lot of time working with the support team to look for things, to identify those signs and those cues. As a medical group, we have additional responsibility from more of a population health standpoint to identify people, right? We don't need to rely on the doctors because we have, I'm sure Gabby knows, all this great data. So we look for people who are having trouble managing their diabetes, who have COPD and all of those. And then at the medical group level, then we reach out, our pharmacists, our health educators as a team. So it is that village that we were all talking about a while ago. Healthcare these days is just not in a doctor office. Mm-hmm. It's everything else. And again, that's why managed care works. Yes. Because there's this broad range of services.
I can't thank you enough for the wealth of information you brought to us today. And again, to those of us listening in, we talked about the Inflation Reduction Act. We are excited that there will be changes coming in as soon as 2023 to your prescription drugs, specifically starting with insulin and vaccines. And please use our contact information, send us an email, send us a DM, and let us know if you have any questions. We'd love to hear your questions, and maybe based on your questions, tailor some new episodes to come on this issue. And also, we will be having resources actually on our YouTube channel, as well as the podcast, the resources that Mindy, Hannah, and Gabrielle talked about, so you have a better way to access them. With that said, thank you so much for tuning in. Remember to follow us on all podcast streaming channels, as well as YouTube and all of our social media, Facebook, Instagram, and Twitter. See you next time. Thank you for tuning in, and have a beautiful, blessed day.
Thank you for joining us today. For more engagement, you can find us at The Avanti Woman on all social and media platforms. Follow us on Instagram, join our community group on Facebook to chat, subscribe to our YouTube for our latest videos. You can rate us 5 stars on Spotify and leave us a review on Apple Podcasts. Thank you for helping us reach even more Avanti women just like you.